Cases of RSV, a respiratory illness, are on the rise. Dr. Malley from Boston Children's Hospital is joining us live right now. Dr. Malley, thank you so much for joining us this morning. Can you tell us what you've been seeing?
Well, I think in general, this is a season where we see a significant increase in the number of general respiratory diseases in children. And we can also say that RSV is a very important player in the viral infections that we're seeing right now at the hospital.
So the CDC recommended a monoclonal antibody to protect infants from RSV. Can you talk about why that treatment has been so hard to come by?
You know, whenever a new medication or new vaccine is approved and is delivered to various states across the United States of America, you end up with some shortages that are related to shifts in demand and the amount of product that is available. It generally has nothing to do with the product itself. It's just that it's very difficult for manufacturers to anticipate exactly how much product will be required. And I think in this case, there was probably an underestimate of the desire of parents to get this very important medication for their children.
And the CDC did just announce this week the release of 77,000 additional doses of that treatment. When you hear that number, 77,000, how impactful will that be for Boston Children's and for other hospitals in Massachusetts?
Yeah, I think in general, any number of doses is good news. They get, of course, divided according to some sort of equitable plan across the United States, and I think that will benefit children equally across the country. It's very important. There will probably be a significant shortage of this medicine for the RSV season, which is one of the reasons why the CDC is trying to provide guidance as to which children to prioritize based on susceptibility to disease or other risk factors that might make them especially vulnerable to this viral infection.
Can you talk about what the signs and symptoms are of RSV and if there's anything parents can do to protect their kids?
In general, the signs of RSV can start as like any cold that all of us have experienced throughout our lives. What makes RSV so much more dangerous than other viral illnesses is that the disease itself can start involving the lungs in a much more significant fashion, where the child can start having difficulty breathing, wheezing. They may have a lot of mucus that is essentially plugging their airways. And in those cases, the children really may require more intensive care, more emergency visits or visits to their primary care provider, for example. Roughly of every 100 cases of RSV disease, maybe 2 to 3% end up requiring some form of hospitalization. So it's a very significant issue. In general, the modalities that can be used to prevent RSV, in addition to the monoclonal antibody that we've been talking about, include other measures that we have learned, for example, during the COVID pandemic, such as avoiding exposing vulnerable children to other individuals who might have the sniffles, might have a cold, might have a fever, just to make sure that you're trying to limit the transmission of this virus.
All right, Dr. Malley from Boston Children's Hospital, such great information. Thank you so much for joining us this morning. We really appreciate it.
My pleasure.